For Durrani Jackson, finding a specialist in Canberra to assess her teenager for ADHD was like finding an elusive puzzle piece.
Well, we couldn't. We didn't actually manage to get anyone in Canberra.
On a friend's recommendation, they instead made an appointment to see a psychologist in Orange, 300 kilometres from home. Within weeks, Phoebe had a diagnosis.
It was like a lot of things. It was like, oh, I'm not actually really bad at these subjects. I just process slower.
The diagnosis came in 2023, but late last year it became clear medication was needed.
It's just these huge cycles of just days of going, I can't think properly. And so I went, we can't do the HSC under these conditions.
Psychologists can't prescribe ADHD medication, and so the hunt for a psychiatrist close to home began.
I have spent 8 months making phone calls, trying to get in.
It came to nothing. Instead, the pair will make the 700-kilometre round trip to see a psychiatrist in Albury later this month.
I really want to in time so that I don't do really badly on the HSC, and I really dislike not doing well.
This is like life and death stuff for our children, and we can't get, and it's not because the professionals aren't amazing, they just have no capacity.
Hopefully not for much longer. The ACT's chief psychiatrist has revealed plans for a pilot program that will see general practitioners diagnose and treat ADHD, a task currently only done by psychiatrists, paediatricians and neurologists.
What we recommend is a plan that has 2 streams. One stream will be for GPs to be able to do the actual diagnosis and prescribing, and the other stream to do the prescribing, but on a much broader level than we have now.
The pilot is likely to start in early 2026 and include a group of more than 70 doctors. They will need to apply to the Chief Health Officer and then complete comprehensive training. Each GP will be supervised by a specialist and be required to refer on complex patients. There will be an age limit for patients, but whether that's 18 or 26-year-olds is yet to be decided.
We need to recognise that we can't meet this need through our private practitioners, so we have to have a different way of managing it, but I wouldn't do it if it wasn't safe.
It's news that prompted paediatrician Kim Bland to breathe a sigh of relief.
Even with my books closed and that being well known, we are still getting daily inquiries from families, not just looking for care like they would for other medical conditions, but being in crisis. How long is it until I have a free appointment?
Turning those families away is one of the hardest parts of her job.
This is just a huge relief for paediatricians. It takes some of that weight that is sitting on top of us and contributing to our burnout, and will remove it for us. It really is a pressure valve for us.
And it's a role general practitioners like Kerry Ost are keen to take on.
Every little bit counts. If one doctor can see, 2 or 3 new patients a week, then that's a huge change to the backlog.
But she warns patients will still need to be, well, patient.
It's not going to be a case of just booking the 15-minute appointment with a GP and coming in and walking out with a diagnosis. It will still take time and patience, and sometimes we do need to try a few things before we get it right, but I do think being able to access regular care with your GP is a really positive step.
When Durrani Jackson considers how different Phoebe's experience could have been had they been part of the pilot, the single mother is brought to tears.
It might have been a very different journey than we've had.
But she's glad the system is improving for others.
Maybe there's a little undiagnosed, girl in year 7 who can be picked up now and find life a much easier journey as a result.
Rosie King, ABC News, Canberra.